vaccine is the cheapest, most reliable source of disease management.
Are you sure Bill Gates did not pay you to promote vaccine?
In a world filled with fear, rumors, and misinformation, one question remains. Why do so many people still distrust vaccines? Meet Dr. Hafsat, a medical doctor, public health professional, and advocate for healthier communities. Working with the National Primary Healthcare Development Agency, she is on a mission to educate, protect, and save lives through truth and awareness. From maternal and child health to community interventions, she's changing the conversation around vaccines.
So there's been misconception. There's the famous one that they're trying to reduce the population of Africans.
I've had people saying, oh, I don't want to take this vaccine because of this vaccine is going to use my age.
Did you hear the one that COVID, and then when people that took COVID in 2021, that's their lifespan, they'll die after 2 to 3 years. Something we call the herd immunity.
Yeah.
When a large group of people have something, like maybe the vaccine, a lot of people had COVID vaccine, so that actually weakened the virus.
Hi, doctor.
Hello.
Yeah, hello everyone. Welcome to another episode of TooHealthTalk, a show gets share real challenges in a very simple and honest conversation. On today's episode, we have a special guest, a very, very special guest in the public health space. But before I introduce her, please, if you want to see more doctors, if you want to know what we're doing here, I'm pleading with you, please subscribe, like, or share this video with someone that might need it. Thank you. So today we're talking about a very important topic in the world at large, in our society, which is vaccination. And I have Dr. Hafsat Umar.
Yes.
Welcome to the show, doctor.
Thank you very much.
When I was going through your profile, you've been in public health for over 6 years.
Yes, I have.
And in the vaccination space, you've done a lot of work, you've done a lot of outreaches. So, vaccine has been there's been a lot of talk about vaccination in Nigeria and the world at large, not even in Nigeria alone, because I was talking to someone and the person was like, Nigeria is even better. The other countries, they don't like vaccine. So there are new vaccine coming out. There's HPV, there's malaria vaccine also out already. So I really want to know, why do people don't get to trust vaccine?
Okay. So I think, it's a concern as well in the public health space. I think there's been a low uptake of low trust in the vaccines, and then they're due to several factors. We know that people now have access to more information in the social media, which they don't verify before taking up that information. There's been a lot of AI content just going around. So I think one of the issues is lack of access to that credible information that people don't get to have. Yes, so it's been, people have wrong information about the vaccines. People come up, and then sometimes from experience as well. Somebody, a neighbor of a neighbor, has had vaccine and something has happened.
True.
They're just hearsay sometimes. So those are the factors that are contributing to that poor uptake.
So now you've talked about why people don't trust vaccine, because of this lack of information. Now, from a public health space, can you tell us what vaccine is for someone that is watching it for the first time, trying to know the real definition of vaccine?
Okay, so in simple terms, it's just vaccines are just introduction of just a bit of that virus or bacteria into the body, for the body to develop soldiers that when the real infection comes to attack your system, your body would have developed immune system, those soldiers that are supposed to fight the infection when the real deal comes. So let's give an example with, if maybe you're injected with a bit of measles. So when you have measles, it's not like you're not going to have measles for the whole of your whole life.
Yeah.
But then again, when it happens, the effect that is going to have on your immune system is not going to be catastrophic. So it's basically just training your immune system to attack it better, kind of a memory for your body when the infection comes. If it's viral or bacterial, when it comes, your body is ready to attack it.
I don't know if I should say this, but I remember then. Now, if you're saying that they are going to inject you a little piece of that virus, so you're saying for them to give you HIV vaccine. In that HIV vaccine, there's a little bit of HIV
No,
in
no,
it.
no. It is modified not to cause that, but we're hoping that we get HIV vaccine soon, hopefully.
Oh, me too.
Yeah.
I pray.
Hopefully.
Wow. So, like, what's the common misconceptions about the vaccine that people have around the world?
So there's been misconceptions that it causes, like, okay, there's the famous one that they're trying to reduce the population of Africans.
Oh,
Yeah, they're trying to cause infertility issues. They're reducing our lifespan. There's a lot. There's a lot. Like there's a lot. Sometimes when you hear about it, it's just a common one, polio.
yeah.
People think it's the polio vaccine that causes people to have polio, whereby polio attacks the nervous system, causing the person that gets polio to have issues with their limbs. So it's the other way around. It's actually the polio that is causing that.
Oh, so now if you are saying people has like this so-called misconception about reducing age, is there any link or connection to, like, when they say that they say like if there's a rumor, there's a bit of truth in the rumor. So is there a bit of truth in the rumor that vaccine reduce people's age?
Not that I'm aware of.
None.
Not that I'm aware of.
Because I have taken some vaccine and I've had people say, "Oh, I don't want to take this vaccine because of this vaccine is going to reduce my age."
Did you hear the one that COVID, and then when people that took COVID in 2021, that their lifespan, they'll die after 2 to 3 years?
Oh, yeah, I've had that one. I did not take COVID vaccine. Did you?
Yeah, so there's something we call the herd immunity.
Yeah.
When like a large group of people have something, like maybe the vaccine, a lot of people had COVID vaccine. So that actually weakened the virus. It's just like smallpox. That's why we are not talking about smallpox. Polio in National Primary Healthcare, they were successful in eradicating polio in Nigeria. So there's smallpox. We don't even hear about smallpox anymore.
Sure.
We're trying to fight measles. We're trying to fight meningitis and other. There's so many vaccinations that actually target those diseases that affect children that are under 5. Those are the very vulnerable age and then the target age. So there's a lot going around the vaccine world.
So now let's talk about COVID
Okay.
and its vaccine. Why do people have issues with COVID vaccine when it came out new?
So it's everybody has a problem. Like I think majority people have issues with new things. Whenever it's something new comes, and then because COVID vaccine was developed within a short period of time, I think that's one of the reasons why. Also, there were so many misconceptions online. People were just going online to talk about, oh no, there's something new. Don't do this. They're going to do that. They're going to do that. There was a time they made people drink salt water.
Yeah, true.
There was a time, like there was a lot that was ongoing. So people having that misinformation, I think that's the number one issue we're having.
Because I know, like, COVID vaccine were like, even in churches, most playgrounds, were saying, don't take the vaccine. If you take the vaccine, your life is going to cut short. There's some people that took the vaccine, and they got sick and they got worse. It's like I was getting a lot of feedback about COVID vaccine. So you now that have worked in the public health space now, were there any, will I say, were there any issue with that particular vaccine?
There wasn't. But then, like I told you, you're introducing something little into the system. So, of course, the body, it's something new. It's just like somebody new coming to your house just to try and sort out and then build up their army. You're going to fight back just so that you can take up your own, your leadership and all of that.
You talked about people taking salt in place of this vaccine during COVID. People were drinking water and salt too. People were even eating bitter cola at that period.
Onions. People were putting onions.
Yeah, I even had someone
in
took
their nose.
onion and like it was too much and the person had issues.
That salt, people were having shock. People were having a lot of issues with that salt intake.
So now I want to know, are there any traditional remedy to, like, if there's no vaccine, there's a traditional remedy to those things?
So, we have to come together with the community and the traditional leaders and everything. Most of these drugs, they're not just gotten from somewhere. Like, they're gotten from the basis. Like, if you come back and look at the herbs and all of that, when you come back and let's say, like people talking about quinine, there's a linkage between Schweppes, the Schweppes, like the elements that are inside the Schweppes are the same that are inside quinine. That is the drug that treats malaria. Then people will just tell you go and drink Schweppes.
Schweppes,
Yes,
true.
for all of that. But then if you look at it, like there's the balancing of we don't know if it's too high. You're just going to take herbs. You don't know if that's and then at the end of the day, those herbs will go and destroy your liver.
True.
So at the end of the day, is that balance between what you're taking, but with moderation. There's been a lot of investigations. There've been a lot of research on some certain things, and then that is why we've sat down and said this will not, when you introduce this, would not harm the body. But then when you're taking some traditional things, they might go and end up, because your liver has to clear those things, so they end up depositing inside the liver. It's just like salt. You take too much salt, and then it takes a big toll on your heart, deposits in places that they're not supposed to be, in turn causing issues with your heart, your blood pressure, and kidneys and other things.
So now you're saying vaccine is good for society?
Yes, vaccine is the cheapest, most reliable means of sorting in the public health space. It is the most cheapest, the most reliable source of disease management. So the popular saying, prevention is better than cure. The cost that you use in treating some things. Let me give you the perfect example. With malaria. Vaccination for malaria is brought to you through the community, through the primary health cares for free, right? When you go to treat malaria, you might not get the anti-malarials for free. If you, God forbid, get the most complicated part of malaria, that it goes to your brain, it goes to other places of your system, the treatment is even more expensive. So we're talking about something that is free versus something that is maybe will cost you hundreds of thousands.
Are you sure Bill Gates did not pay you to promote vaccine?
Well, I've never met Bill Gates, so but when I meet him, maybe.
Because that's the same thing that they're talking about when Apoco Doctor released some like enlightening videos about vaccine, and everybody was coming after him that they've paid him to kill his own people. So that I'm throwing this question to you now.
I think we need to check the
you
people that have died from 2021 from COVID vaccine to date. Let's see that, and then the population. I think we need to check that. People that have taken, I don't think that it has any effect on that.
Oh, so now you've worked with the primary health care center.
Yes, I have.
And me seeing all these stuffs online that people are having issues with this vaccine. You've been on the grassroots level. Were there any challenges, like any serious challenges of you passing out this vaccine to the grassroots?
So I think with us, one of the key things that we've succeeded in doing is advocacy. So we bring aboard traditional leaders, we bring about religious leaders, and then key stakeholders that actually are important in the community. So before you go to any community, you have to go through the gatekeepers of that community.
Sure.
So at least you have to enlighten them, and then these people, they actually know the benefits of these vaccines. Yes, you might get one or two issues of people. There was actually an instance that the Meungwa, that is the head of a community, that actually said he was going to evict a certain person from his community if he doesn't let them do polio vaccine, because we went for polio vaccination. We went for a campaign for polio. And he said he was going to evict him. Why? Because they've had zero cases of polio in that community. But then again, in the neighboring community, they had a positive case. So they had a suspected case, rather, not a positive case, a suspected case. So he was like, no, you're not going to bring polio into my community. And then he threatened to actually. So you have to work with them, with the community, you have to work with the key players, you have to work with everybody to achieve that. So advocacy is one thing that we've done, and then so far we're still working on it.
Oh, so
Yes.
even referring back to the Apoco doctor issue, I saw even some like health workers talking about, oh, vaccine is not good. Is there any role that health workers need to play in like creating this awareness about vaccination?
So I think the healthcare workers, we the public health workers, were the ones that bridge up the. So I think the most especially we can talk about the community health extension
Okay.
workers, the midwives and the nurses. Those are the linkage between the healthcare and then the community. So those are the ones that bridge up, and then I think most of them is enlightenment, trainings about all of this. Yes, there are some people are so hell bent on their ways, on what they believe, their beliefs, and all of that. But still, with more trainings and enlightenment, I think we can achieve that. So, that linkage between the community not having the right information and then the healthcare providing the right treatment, we can bridge up that gap.
Oh, so has there been any like cases where someone refused, like a community refused? Because I know you've been in the game for 6 years. Have you been any case where a community refused to take this vaccine and the outbreak like spread so fast or like exploded?
So I think so far with the years that I've maybe before I joined the public health space, but I think there's been a lot of improvement down the years.
Oh,
So I'm sure then, in fact, there were instances that people go to advocate for the vaccines and they will be chased out by the touts or you youths of the community. That was then, like we've heard stories like that, but then now it's not the case. So I think together, if we're working, I've not encountered that type of scenario, but I think yeah, we've come a long way.
oh, okay.
Yes,
You talked about community health extension workers when you were describing. So now, have you worked closely with them?
yes, I have.
How was
I've
your
trained
experience?
them.
You've trained them.
I've trained them. Yeah, we've worked
So
together.
how was your experience with the community health extension worker?
So I think it's been pleasant.
Oh,
Yeah, it's been pleasant. I think the only thing, most of the things, is more trainings to be done to them, and then trainings on not only trainings on service delivery, trainings on attitude as well. So
attitude.
yes,
They have bad
sometimes
attitude.
no. Like sometimes it's the perception. We the medical healthcare professionals, we have a way of just dropping jargons. So I'll just tell you, oh yeah, you have your immune cells are fighting this and that. Oh no, you can come. I'll tell you, oh no, your titer is high and this and that. There's three pluses of you don't even know what it is, and then with time, oh nobody is explaining that, and then the healthcare workers might be, they've just been overworked or something. So their attitude to some patients they might not all, but some they might have one or two experiences. Yes, it happens. And then when we train them on service delivery and then provision of respectful care, I think we can achieve. But yeah, there are a lot of willing community health extension workers.
So now there's
Yeah.
something I saw on TikTok one time, was it last month? Someone was saying if there's no doctor in a community, the person in charge there, the community extension worker, they do the consultation and everything. Is that true?
In the primary health cares, yes. So
Or
there is something we call the so there is from Ministry of Health, there's some policies that are put in place, right? When there are no medical doctors in the primary health care, we train these community health extension workers with the midwives and the nurses to it's primary healthcare. So the whole is they're the first contact to care. So if it's something that they can't manage, they take it up to the next level of care. That's why we're bridging up, we're doing referral systems. And, so when there's something that is beyond the capacity of the community health extension worker, he can take it to where is appropriate. But they're trained in doing a few things, if there's a cut, you don't expect to go all the way, they can train you. You have some key malaria, they can, they have a lab they can send you, they'll do consultations for you and then send to appropriate. They'll give you the appropriate care.
Because stuff was causing issues between nurses and extension and community extension workers. They were like, oh, they own the primary community extension worker. They are saying they own the primary healthcare. That they are the boss there. That nurses
The
are.
community owns the primary healthcare, not any healthcare worker.
They should take it from me.
Yeah, the community owns the primary healthcare, so yeah, it's not a debate.
It's not a debate.
Yeah, because they're the recipient of care. So if nobody is coming, what's the whole point of a community health extension worker or a midwife in the place? What's the point of the primary health care?
True.
Yeah.
So now, for those people like, I will not say me, because I've accepted the fact that okay, I need to take this vaccine, even with the fact that I'm working in the hospital, so I just need to take the vaccine because that's one of the criteria also. But for some people that
You can take hepatitis B if you've not.
I've had.
Are you sure?
Yeah.
Okay.
That was the first one.
Okay, there's a lot.
So for people that don't trust this vaccine, how can we build trust?
So a lot of advocacy, and then a lot of contents like this have to be pushed to social media so that at least the right information is being passed across. There are so many doctors that are doing a lot of beautiful things online. We've been coming across them. There's this health talk that,
Thank you.
yeah, we've seen a lot. And then even if you don't, at least, okay, maybe you have an information that has just been, maybe you've seen it in a page of somebody random, at least you can go to verified sources and then verify it. Not that you go to Dr. Google and type, oh, I have this and that and that. Yeah, at least the verified sources.
I think most doctors have issues with Google.
Because Google is very vast. So it will give you have a headache and fever. It's also available in several diseases as well. You could have a brain cancer. That's what Dr. Google will take you to, and then you start doubting yourself. You start doubting if you have brain cancer or not.
Because I'm believing that like most doctors just complain, why is this patient going to Google? Like,
yes, because some people will come to you with their diagnosis. When they come, they'll just bring you, oh, I think I have, and then meanwhile, there's nothing. It could be dehydrated. That's why you're having this. Oh no, I have this and that.
oh, because now I'm saying that most doctors have issues with Google, and it's not even going to the fact that they now have issues with ChatGPT.
Okay. AI, I think we can integrate it into healthcare system. Integration, not solely dependent on it, right? It's still the same. It's a algorithm that you're feeding. You're feeding the algorithm. So you say, as a doctor, you come to me with headache, right? Or you come to me with body pains. Perfect example. And then you forgot to mention to ChatGPT that you've taken a vaccine before then, right? For me, as based on my own experience, I'll ask you any history of this. There's a template that we've been taught, so just so that we can go through everything holistic. We work the same way too. Whatever you feed us, that's where we would go, and then at the end of the day. But you've done that, and ChatGPT is giving you. ChatGPT did not check your lymphocytes, your white blood cell count. ChatGPT did not check other things, but then you've concluded this is what you have. But for me as a doctor, I'll send you to go and do some investigations.
So you think ChatGPT is not coming to take your job?
No, I don't think so.
100% sure?
I am 101% sure.
Because I hear people saying ChatGPT is coming to take your job.
ChatGPT doesn't have legs. So ChatGPT cannot deliver the care that person needs.
Oh,
Yeah.
okay.
But maybe when ChatGPT grows legs, we're going to come back to this conversation.
Okay.
Yeah.
Yeah, AI is not taking doctor's job, so
Yeah.
let's see to that now. In the next 5 years, we'll
But
see
we
if AI
can we can integrate it into our work to make our work faster and easier. That is what a lot of people are looking to do.
Because someone was saying that it took doctors like 7 to 8 years to study medicine, but it took, and like for example now, for you to do a residency in radiology, it didn't take like 7 years. Now you use 7 years to do your residency, but and just to study images. But AI just run the images for you. So people are saying that AI is going to take your job.
But while you're in school, you learnt of other things as well. You've learned how to emotionally attend to that person as well when they are in fear and all of that. So you can put your radio image to ChatGPT, and ChatGPT will not tell you to calm down before the results comes out. So at least there are different benefits.
True. I
Yeah.
think, yeah, true. ChatGPT will not calm you down.
No, he won't. He'll tell you that you might have, and
So,
he ask you what you want to do further.
true. So, lastly, before we go, for someone that is unsure about this vaccine or that is scared to take this vaccine, what do you have for them?
So vaccines have helped a lot. We've had a lot of under 5 mortality being dropped because of the benefits of vaccines. There's a vaccine that supports with acute diarrhea and is one of the leading causes of child mortality, under 5 mortality.
Oh.
So if you can give your child that, rotavirus, yeah. So there is a very notorious virus called rota that actually causes severe diarrhea in under 5 and causes mortality. And majority of this mortality is being caused by that.
Wow.
So if you can vaccinate your child to protect him from that, so both the morbidity and the mortality, if we can hold hands together, I think vaccine helps, and it's cheap, it's accessible, it's free, it's, all the benefits are there. It's okay to have concerns, but I think we should hold hands together and pass down, we as healthcare workers, pass down the right information, and then also the public should seek for the right information from the necessary and the right chain of information, not just going randomly to look for information elsewhere
AI.
or listen to the neighbor or someone said or the market square and so
Sure.
on. Yeah.
Thank you so much for sharing your insights with us. Like, I've learned so much from you today.
You
And I believe also that people watching us will also have learned something about
I hope
vaccine.
so.
Thank you so much for coming on the
Alright.
show, Doctor.
Thank you.
So if you want to support what we do here, please, I'm pleading, like, subscribe, and share this video to someone that might have doubt about vaccine or have issues with vaccine. If you have any questions for Doctor, you can reach out. You can drop the questions in the comment section or reach out to us. We'll get them to reach Doctor. Thank you for watching up this moment once again. See you in our next episode.
Thank you very much.